What? Your doctor said stop running? Come on, you gotta be joking me. Why would your doctor tell you to stop running? That is only going to frustrate you, depress you, and ultimately leave you heartbroken. It's about getting to the root problem. Hey everyone, it's Dr. Heather, your virtual sports chiropractor. And if you are like many of my runners, you may have been told by your doctor to stop running simply because the doctor is now telling you you have osteoarthritis, known as OA, and they are now telling you, more like scaring you into the fact that you may need either a knee replacement or a hip replacement due to this condition. But I'm here to tell you that actually is not the case. You do not need to stop running. I'm going to provide you with 5 helpful tips regarding OA and what you can do about them that your doctor may have not told you. All right, so let's talk about OA. What is osteoarthritis? Because I see this a ton of times throughout all the different social media platforms, runners being diagnosed with this condition, their doctor telling them that they're gonna need to stop running and they don't know what to do because they are literally heartbroken. So I want to actually share with you a quick story regarding one of the very first clients I got to work with back when the pandemic first hit. His name was Mike. He was a 54-year-old runner. He really just enjoyed running for a pastime, but his favorite thing to do was to actually go running with his daughter. So when he would go visit his daughter who lived out in the mid-states, he would actually go to some of the nice national parks and they would do some trail running. So he was really devastated when he got diagnosed with this condition because he didn't want to give up this one passion that he has, and I love that he shares with his daughter. So when we first met, we went through our general assessment, and come to find out, I was able to help him get back to running by doing a few things that I actually am going to share with you today that you may not really recognize, and it's stuff that you can do if you've been recently diagnosed with OA. So let's first look at what is osteoarthritis? What is this condition? OA is referred to as a wear and tear disease. It causes changes to the bone and deterioration of the connective tissues that hold the joint together and attach the muscle to the bone. So right there, we know essentially everything's just being broken down. And a lot of times OA is associated with increased inflammation within that joint surface just because of the wearing and tearing that's become evident, especially in the knee joint. What happens is then the bursa sacs that hold fluid then start to become very irritated and sometimes can create the swelling. So a lot of times OA is also associated with some swelling, sharp pain, discomfort, and I just want to make sure you guys understand that OA isn't really an inflammatory condition. It is an arthritis, but it really is a wearing and tearing of the joint itself. And then subsequently, we get that inflammation in that area. Now, like I said, I want to go through 5 things that you can do if you've been recently diagnosed with this condition that are really going to help you. And I want you to pay close attention here because each one is very unique and specific to the condition. And these are some of the tricks and tips I've used with clients of mine who have suffered with this condition. We've got them right back to running. And I want you to pay specific attention to number 4. It is kind of like the key holder to all of this. Now, if you aren't familiar with like a Synvis shot, and this would be the number one thing you could do, is you can actually ask your doctor not for the cortisone injection. Remember something, if we do cortisone injection into any joint surface, it will increase the rate of degeneration, which we don't want because our bones are already wearing and tearing down. So we don't want to increase the degeneration here. So do stay away from the cortisone injection. Look at getting a Synvis shot, which is going to actually add a little bit more fluid into that joint surface area. And these have been hugely successful with people who have suffered with meniscus injuries, ACL injuries, medial collateral, lateral ligament injuries as well. So definitely, again, do first talk to your doctor about a Synvis shot. The second thing you can do is you don't necessarily, like I said, want to stop all activity. The next thing we want to start doing is looking at our muscular imbalances. This is something I do talk a lot about on the channel. When we look at doing a functional movement screening, really having an understanding of what's going on, where our strong muscles are, our over-dominant muscles, where our weak muscles lay, and then from there, making sure that we are playing to our strengths, meaning that we're starting to create a workout routine, still involving the running, but maybe it's not daily, maybe it's every other day, and then we're adding in a few other things to help offset that knee discomfort that you might be experiencing from OA. So this is where we would start to look at your muscle imbalances and really starting to tailor the workouts towards you, and as well as correcting any of those biomechanical issues that you're having when you're performing any of the activities. Now, the third thing we can definitely do is look at our diet. And you might be going, okay, how does the diet affect this? Well, if you heard me initially when we started this conversation about OA is a lot of times associated with increased inflammation into our system, into our body. So if we're holding on to all this inflammation, we do want to take a look at the foods that we're eating and the things that we are supplementing into our diet that could possibly help in reducing the inflammation within this joint area. So this is where you might see a lot of people starting to talk about things like turmeric. Turmeric is a great anti-inflammatory supplementation that you could look at adding into your foods, as well as making sure that the foods that you're eating are more organic, more foods that are going to go ahead and reduce the inflammation that might be setting into your body. This is also where we would look at also increasing our water intake. Water is just a great way to reduce inflammation because guess what? It doesn't cost us anything, it's free, but also too, hydration alone will go ahead and start lubricating our joints even more. But like I said, you can test out turmeric. Turmeric is a great supplement that you can add in, which has great anti-inflammatory properties. Now, number 4 actually is my secret recipe, my secret sauce when it comes to dealing with people who have OA, and that is a TENS unit. Now, in my 27 tips and tricks for runners on injury prevention, the TENS unit is actually in there. It's a great tool to use to, one, help promote recovery, decrease inflammation, but also work on strengthening our muscle imbalances. Now, with any patient of mine, any client of mine that I've worked with, whether it be in person or virtual, who has gone ahead, seen their orthopedic, gotten the Synvis shot, when we go ahead and couple that with doing a TENS unit by placing the pads on the inside of the knee and on the outside of the knee, just above the knee joint, and utilizing that to really allow for that shot to start to penetrate even further in and allowing for the vastus medialis muscle to start really working a lot better and taking out any tension in the IT band area, we're noticing that there is better ease, increased range of motion, and flexion and extension of the actual knee joint that allows that individual to feel more comfortable when they go out on their run. Now, the final little tip here, and you guys know I'm very big on myofascial work. You've seen it here on the channel. There's the 8-part series that goes through a head-to-toe approach. I'm really showing you guys how to use the foam roller, the massage ball, to really break down the connective tissue. Now, if we look at OA, and we know OA already is a wear and tear disease, what better way to really start breaking up some tissue, some scar tissue, and increasing flexibility and joint mobility by then utilizing a foam roller and massage ball. Now, there are some simple things that you can do to address this around the knee, and that would be simply by looking at working on our IT band, hamstring, quad, and even our adductors. Now, those are my 5 tips for any of you who were told to stop running due to OA. And I'm here to tell you, I'm here to give you that hope back. There is hope at the end of this tunnel. It is very possible to continue running if you have osteoarthritis. Now, if you need more information regarding your specific condition, how these things would all work, feel free to drop those comments down below or book that free consultation with me. I'm happy to provide you some guaranteed insight into what the next steps might be for you. But again, like as always, if you've liked this video and if you found it helpful, give it a like, and don't forget to subscribe to the channel, as we are always giving you guys, especially my running community, great advice on how to continue doing the thing that you love most, which is going out running. All right, everyone, I'll catch you in the next video.